Hi everybody. Welcome to the stream. Thank you for joining me today. I'm Dr. Sylvia, a GP and health educator with Askawayhealth. How are you doing today? I'm in Scrubs. It is so hot. It is so hot where I am coming to you from South Yorkshire. Temperature, I think, is 29 degrees. It is 32 degrees in France, and you might have heard about all the fires and events going on in France. Goodness, the heat has really gone up. Lagos, 28 degrees. So please let me know if you're joining me live or watching the replay. Let me know where you're watching from. What is the weather doing to you over there? But I hope that the Friday and the weekend is starting off very well for you. So today we are talking about fibroids. Again, we talked about fibroids last week, and we're talking about fibroids and shrinking fibroids, what kind of measures, what kind of options. That was last week's live stream. If you didn't, or if you haven't watched it, please go and check it out. But today we're going to be looking at fibroids in pregnancy. So if this is something that is interesting to you, I've got a few questions that I'm going to address in this live stream, but I'd love to hear from you. So if you've got a comment or you want to ask a question, please feel free to drop the comments for me. I will be hopping in between the chat and the comment section. I'd love to hear from you. Or if you're watching on replay, please send me a question and we can hopefully maybe tackle it in an upcoming live stream or do it on a separate video. So let's just get started. I'm going to be sharing my screen. So let's pull things up and jump first in. I thought, as I always do, I like to provide you with a little bit of background. Okay, so we're going to talk a little bit about what fibroids are, just in case somebody who doesn't know, has never heard of these before, comes across the channel, you get up to speed with what we're talking about. So I'm going to be doing that first, just creating a little bit of a background, and then we'll go into the questions about fibroids and pregnancy. Okay, so bear with me. Let us get ourselves started. Let's get the screen share on and then take things from there. Brilliant. Okay, so which one did I want us to start with? Let's go for that one. Okay, so yeah, so there we go. Let me just make sure that you've got the right image on. I know sometimes this just does this a bit. I'm not sure why. No, not that one. So let us see. So share screen. Yep. It's this one I think that we need. Let's see if we... Yep, that looks like it. So yeah, if you joined me last week, you're familiar with this image, and it's just an image of a womb with fibroids. But just to put it in context, what we're talking about, and we want to start by defining what a fibroid is. Fibroid is a benign growth, or you might hear it referred to as a tumor that happens in the womb. Okay, so women, generally women of reproductive age, so women who can still have kids, fibroids are benign growths that affect the womb. Very, very common, much more common than you might think, particularly because many women have fibroids, but because they haven't got symptoms, it doesn't cause any problem. So they may not even realize that they have fibroids, and you would only find out if you were doing a scan looking for something else and say, oh, actually she's got fibroids. And remember that fibroids can grow to different sizes, from the very tiny to, of course, the very large ones. Now, of course, we're doing this discussion today because fibroids can be symptomatic. That is, they can cause problems, okay? But before I talk about a few of the symptoms, where do fibroids, how do they grow? Where do they come from? Now, we know they develop from the womb's muscle, okay? So this image that I've shared with you, what you can see on the screen is the womb, and the fibroids, like that one or that one, so all these bumps that you're seeing, the bulkiness of the womb is because of the fibroids. And what you're seeing has developed from the muscle of the womb, okay? So fibroids grow from the womb muscle and mainly depend on estrogen. They mainly depend on estrogen in your body or in a woman's body to grow. So estrogen, the hormone estrogen, is a big influence, okay? But not all types of estrogen. The estrogen that your body generates, that your body produces, different from the estrogen you're getting in the pill, combined pill, for example, okay? However, we also know that other factors are related to fibroids developing, but we don't know exactly how. So it's still a bit of a mystery for scientists and researchers. We're not very sure, still doing studies about this, okay? Now, the other thing that you should know is that fibroids, we've said they grow, they're coming from the womb, but they grow in different aspects, in different locations within the womb. You can divide the womb into the very top layer, the middle layer, and the inner layer. So if you think about it, your skin can be the inner layer. If you wear a blouse, let's look at that as the middle layer or the muscle layer of the fibroid. And if you put a jacket on top of that, so those three layers, from your skin to the blouse to the jacket, just imagine. I know this is a really strange way of describing it, but I'm just trying to explain to you how the womb is formed in layers, okay? So fibroids can grow from the muscle and they can grow into the inner layer, that's the inner cavity where the baby stays, or the fibroid can remain within the wall or can grow into the outer layer, okay? So fibroids can grow outside the outer layer, okay, a muscle from the muscle of the womb, but it's going to the outer layer, within the muscle of the womb, and a growth from the muscle of the womb, but enters into the inner layer or the inner cavity of the womb. So that's how fibroids will grow. And I'm going to show you a picture. Please don't go away, don't feel confused. I will show you a picture and explain this a bit better when we get to that section. What about symptoms of fibroids? The common symptoms, there are quite a few and they can vary from one woman to the next. What that means is that two women may have fibroids and may have symptoms from fibroids, but they have different types of symptoms. So generally, painful periods, abnormal bleeding from the womb, abnormal vaginal bleeding, okay? So fibroids can cause painful periods, heavy periods, bleeding in between periods, okay? So I wanted to make sure that you're quite clear in your head. It can cause abnormal bleeding. What kind of abnormal bleeding? It can make your periods heavy, can make the heavy periods painful, and it can also cause bleeding different from the periods and happen in between. So fibroids can do all that. I've mentioned pain. Fibroids can cause pain in your pelvis, so the area just above your thighs, and higher up in the abdomen, because remember, fibroids, a lot of it is about the bulk of the fibroid. Okay, a lot of it is about how big the fibroid is. So a lot of the effects that happen because of the fibroid is because this size, this bulk, is pushing other things within your abdomen and pelvis, pushing on the ovary, pushing against the bowel, pushing against the bladder. And as it even grows bigger, grows out into the abdomen, can start pushing against the nerves around your back, pushing around different things and causing pain, okay? Related to that, I've just mentioned how the fibroid can push against organs. If it pushes against the bowel, for example, it can block the bowel and cause constipation, or it can push against the bladder. The fibroid can push. Remember that the womb itself is sitting between the bladder in front and the anus and rectum and bowel behind. So if this fibroid grows and makes the womb so large, the womb pushes against the bladder, it might cause problems with urinating. So these are some of the symptoms. And back pain, I've mentioned, if it's pressing against the nerves. Many different things can happen with fibroids. A lot of this I talk about in videos dedicated to the subject. I talk about symptoms of fibroids, the causes of fibroids. Please go and check out the most popular playlist channel or playlist of videos on fibroids. It's on this channel. So look for fibroid knowledge playlist. I will put the link in the description if I get the chance, and remember, I'll just show it to you later on this stream. But if you want to learn much more about this, go and check out that playlist. I go into a lot of detail in individual videos, okay? Now, let's talk about who experiences fibroids. Why is it that one person gets it and the other person doesn't? So let's look at age. First of all, fibroids are very rare before puberty. Okay, so fibroids are not a childhood problem, if you like. I think that's the way to put it. I wouldn't expect to see fibroids in somebody who is 11 or 12. They're very rare, okay, before puberty. You can have, however, you can have fibroids in teens. Not so common. Okay, very quick to say, not so common, but it can happen. In fact, I keep saying, I came across a really interesting case study of a girl, age 14, who had fibroids, horrendous, heavy, painful bleeding, and then eventually, after the test done, she had fibroids. So it can happen. It's not very common in young girls who are in their teens. Fibroid is much commoner in older ladies, in older women, and most often we diagnose it between the ages of 30 to 40 years of age. And you find that the rate at which it happens is a lot higher in women as they go into their 70s, into their 80s. You find a lot more diagnosed with fibroids. Now, an important aspect of fibroids is understanding what are the risk factors for fibroids. Okay, I'm going to go back and have a look at the comments in a minute, but let me just finish this section where we're just laying foundation. What are the risk factors for fibroids? Really important to know this. Like I said, we're still trying to learn about this condition. So many things that we don't yet know. Okay. But we have said that there is a relationship between fibroids growing and developing and estrogen. And that's estrogen that your body produces, not estrogen that you're taking that's coming from the outside. This is estrogen that your body is generating or developing. Some of these risk factors that have been linked to fibroids, that is, people are more likely to develop fibroids if they're in these categories. Number one, somebody gets into puberty early. Okay, we call it menarche when a woman starts her first menstrual period. So a woman who has, and for girls it can be different ages. Some girls get it as early as 10, some as early as 8, some later, 14. It varies. Okay, well, what we found is that those who enter menarche, who start their periods earlier, tend to be more at risk of having fibroids. Now remember, this is not categorical that everybody who starts periods early ends up with fibroids. No, we're just saying that an association, there's a link. You're likely to find that if somebody has fibroids, possibly she may have started her periods early. And remember, we're looking at frequency. It's not exact. So again, we're not saying that every woman who has fibroids started her periods early. I hope I'm clear in that. Okay. The other risk factor associated with fibroids is a woman who hasn't had children. So she's not been pregnant. She's not had children. She's not been pregnant. And again, that has to do with hormones, because when one is pregnant, normal hormone production is interrupted. You either have more hormones, reproductive hormones being produced for the 9 months, or you have, when a woman is not pregnant, that interruption doesn't happen. So when those interruptions don't happen, there might be a chance that fibroids prefer that kind of scenario and they develop more in that kind of scenario. Now, it doesn't mean that every single person who's never been pregnant then will develop fibroids. No, we're just saying that there has been an observation that women who have fibroids tend to be more in that category who have not been pregnant before. And I know you're going to say, well, could it be because the fibroid didn't allow them to get pregnant? Fair enough. I get you. I understand what you're saying. And we're going to talk a bit about that as well. But this is just one of the observations about the risk factors. That is the conditions that make somebody probably more at risk of developing fibroids. So we've talked about starting periods early. We've talked about not getting pregnant or having children at all. The next one is being overweight or obesity. Okay, and that one again has to do with hormones, because the studies indicate to us that people who are overweight have higher levels of estrogen, that estrogen word again, and its association with fibroids. Next is women who start their menopause later, or women who go into the menopause later. Commonly, when we talk about menopause, we're talking about from the age of 45. Some women will start to experience the perimenopause. Some might even start earlier. But on average, you're looking at about 48, going up to 50, 52 years for a woman to enter into the menopause. What of a woman who gets into it later, maybe after 52 or 53, when she completely stops having her periods? So we're saying that women towards that later end of the spectrum are the ones who may be more likely to have fibroids. There is also a family history of fibroids. So what that means is that if there are other ladies in the family, whether it's sisters or mothers or female cousins and so on, who have fibroids, then whoever they're related to could be more at risk of developing fibroids. Now, last but not the least risk factor is being of African descent like me. Okay, that has been identified actually as the most significant risk factor that you can't do anything about, because you can't do anything about your background, can you? But what we've observed is that more fibroids tend to affect more Africans, African Americans, Afro-Caribbeans, or whichever way. People of African descent tend to experience fibroids more, so it's more often diagnosed. In them, they tend to have more severe symptoms. We're still doing the studies. We're not really clear on why this is the case. Okay, so that's a little bit of a whistle-stop tour about fibroids, what they are, who gets them, why, what causes it, and so on, and symptoms. Before I finish that topic, I would like to say research has also identified that there is a reduced risk of having fibroids, okay, if you have had lots of children or you've been pregnant a number of times, okay, if you smoke. Now, that is, the studies don't weigh one way or the other. So what that means is that some studies will say smoking, there's an increased risk with developing fibroids if you smoke. Some other studies say, well, women who smoke tend to have less fibroids. Smoking itself has certain health issues associated with it. So in the first instance, it's always beneficial to cut down on smoking. I am certainly not advocating that you start smoking to reduce your risk of fibroids. No, I'm just saying these are some of the findings from studies. And the other thing is the studies have also demonstrated the reduced risk or happening or occurrence of fibroids in women who use the combination pill that contains estrogen and progesterone. So just to throw that into the mix. So I would love you to understand that it's an area that there's still so much study going on. There's still a lot that we don't know about, so many things that we're trying to understand about fibroids, and these are some of the issues around. So now, believe me, it is a warm day. Okay, so now let us get to the meat of the matter. And what we're talking about is association with pregnancy. That's what we want to look at today. Those are the things that are really important. And of course, you guys know I usually get the questions or the topics that we cover on our live streams, on our live classes from our viewers. So this came in as a question from one of my viewers, and it was about, how do we look after fibroids? How can we look after fibroids if we're pregnant? What is the treatment of fibroids if you're pregnant? So of course, we're going to talk about these, and I've got a few questions sort of lined out for us to look at. And the first one, as you can see from the banner here, is, can you get pregnant with fibroids? And if so, are there any special complications? Well, that's what this whole video is about. We're going to go into that, okay? But I thought, so what this implies in the first instance is, does having fibroids mean you cannot get pregnant? So very quickly, I'm going to say from the outset, no. Having fibroids does not mean you cannot get pregnant. Let's go and let's share the screen again so I can get one of the images I promised I was going to share with you, and then we can have a good look. So I'm just going to let's share that one, and I'm just going to change the image. Okay, so I'll just double check that we're seeing the same thing. Yeah, okay, let me just remove that so that you can see clearly. Very good. So, yeah, so what we're talking about now is, does simply having fibroids mean that you cannot get pregnant? So the answer to that is no. Fibroids can have an impact on fertility, and we're going to talk about that. But just having fibroids, the blanket response to that is, you cannot say that just because somebody has fibroids, they cannot get pregnant, okay? It depends. It depends, and it's important for you to know why. And the why is because there are different types of fibroids. Remember at the beginning of this, I said to you, I tried to describe to you the different layers of the womb. So this is what I was trying to describe. In the outer layer, you could have what's called a subserosal fibroid. So the fibroid is growing out from the outer layer of the womb here, and it's going out into the abdominal space. Okay. You can have a fibroid that develops right within the muscle of the womb. And you can see that, so this pink here sort of represents the muscle, the womb muscle, and this fibroid is sort of within that muscle space. And this fibroid can go big, and as it grows big, it can go that way outwards, or it can go inwards into the womb itself. Okay. So, but this is coming right from the wall of the muscle wall of the womb. Okay, and by the way, these are the ovaries. So you've got the ovaries here, just in case you're trying to orient yourself across this picture. That's the ovary, fallopian tubes. Okay, so that's the womb. Okay, so just going back to that, the third type of fibroid, and these are major types. I don't want us to get too technical so that we don't get confused. But the third type is the one that grows from within the inner layer. So that is, inner layer means the inner cavity where the baby will sit if a woman was pregnant. So right in here where my cursor is. And so you have fibroids that are entering, that go into that layer, like this one up here. Or you can have this one here, which is sort of going into the vaginal canal. But you can see how quickly or how easily this can affect a baby that's growing in here. So when we ask ourselves the question about whether fibroids can affect, or can you get pregnant with fibroids? Yes, you can. It depends on where the fibroid is. So that's why we talk about the type and the location of the fibroid. If you had one that was sort of growing here, if that was all you had and all these other ones were not present, then pregnancy is possible. The baby can grow within the womb, inside the womb here. The problems that the person with this type of fibroid might have is, as it grows bigger, it might press against other parts of the other organs and cause pain. It might twist around itself, cause pain and bleeding, things like that. But not that it will affect the ability of the baby, of the pregnancy to plant within the womb cavity, which is what might happen if you have one like this one. Or the submucosal one, sorry, that goes right, that's actually going right within the cavity. You can see how it's pushing right into the cavity of the womb where the baby should be sitting. So just going back to that question to make sure that we've really covered it nicely, that question where we're talking about, can you get pregnant with fibroids? Does having fibroids mean you cannot get pregnant? So I'll say no, you can't make that kind of blanket assumption. It depends on the type and location of the fibroids. Okay, so hopefully I've covered that and this is nicely well explained. If you're just joining, thank you so much for popping in. Please leave a comment. Don't forget to like the video. And if you find this useful, please subscribe to the channel. We're talking about fibroids and pregnancy. We're looking at different issues that can happen to stress a woman if she's got fibroids related to pregnancy. And we just started by giving a little bit of an update of what fibroids are, just a little bit of background, and we've only just begun with the first question. So if you're just joining us, that's where we're up to. So let us go to the next question. I'm just going to put it up so that you can work along with me. And so we're now looking at what happens to fibroids in pregnancy. Okay, so when you have fibroids and you get pregnant, what should you expect? Does the fact that you're pregnant make the fibroids grow bigger, or could it grow smaller? Okay, so that's what we're tackling in this question. When you're pregnant, most fibroids. Now, the thing about it, we tend to hear about fibroids and talk about them because they're symptomatic. But if you consider an iceberg where you have the tip of the iceberg above the water, remember that the bigger weight of the iceberg is really underneath the water. Fibroids and how they affect women to an extent is similar. It can cause really terrible, distressing symptoms. And that can take all our attention. But in the majority of women, they have no symptoms. Okay, in the majority of women, we've talked about just how common fibroids are. So common. Sometimes 1 in 3, you could actually take a walk down the street, and if you meet maybe 50 or 100 people as you walk, 1 in 3 women that you encounter may have fibroids or may know somebody who has fibroids. That's how common. So they're quite common. And most of the time when you're pregnant, they don't grow. Most of the time. However, it can happen. I just wanted to emphasize that it is possible that nothing happens to the fibroids, but they can grow when you're pregnant. Again, don't forget the link to estrogen, the link to hormones. That's why and if it's going to grow, if the size of the fibroid is going to increase, it will happen usually around the first trimester, first 13 weeks of your pregnancy. And that's because the fibroids depend on estrogen, which levels are increasing, because of course that's helping to support your pregnancy. Your body produces more of it when you're pregnant, so the fibroids will grow. And then after the babies come and the estrogen levels start to come down, then the fibroids often shrink. That's generally what will happen for most women who don't have issues with their fibroids in pregnancy. Okay, so that's what happens to fibroids in pregnancy. And I think that just takes us very nicely into what is the main thing that we want to look at. And I've just titled my video the 10 factors or 10 issues that can cause stress in pregnancy. And I'm going to take you through them one by one. And we're going to go through them one by one. And when I need to share the screen, I'll pull up a couple of images that I thought might be nice and interesting for you to see. And then we'll look at them in each way. So the first condition or the first issue around fibroids and pregnancy that can be stressful is the possibility or the ability of a fibroid to prevent a pregnancy. Okay, I know I've said a lot about how many women it's asymptomatic and so on, but sometimes fibroids can prevent pregnancy and lead to infertility. There's still a lot of studies to try and work out how this happens. But if you just think about it, and let me just pull up one of I'm going to share the screen again, because I've just remembered I've got a nice picture that will hopefully help us understand this a bit better. So let me see if I can actually find it. Bear with me. That one. Okay. So let's see. Okay, that's similar. Okay, well, let's use this one. It's pretty much just showing this, the same as what I described in the last one. So you've got the ovaries here and here, yeah, and you've got the fallopian tube. Okay, so that's the relationship between the ovary and the fallopian tube. And then as it enters into the body of the womb, so that's the womb itself. The 2 fallopian tubes, that's the second one on this side, and then the other ovary. Okay, that's the relationship. So fibroids can pretty much grow anywhere, even if it's a fibroid that's like an outside one that's growing on the outside layer of the womb. What if it grows so large that it's able to block or obstruct the tube? So you just need to use a bit of imagination here. I mean, assuming there was a fibroid here, for example, where my cursor is, and it's growing so large. Just check that you can actually see what I'm seeing. Yes, okay. Okay. So if you had a fibroid here and it grew so large that it could block the tube, okay, now what does that mean? It means that when ovulation happens and ovulation, the egg is released from the ovary and it's making its way down the tube, follow my cursor, and gets here. But because the fibroid has managed to grow itself so large, it's pressing against the tube, and the tubes are tiny, and closing the tube, the egg cannot go through to meet with any sperm within the womb. So even that first stage of fertilization, a fibroid could interrupt it. Okay. Now, the other possibility, and like I said, research is still going on into how fibroids can affect fertility, but the other possibility is, have a look here, within the cavity of the womb. Okay, one of the things that fibroids does in the womb is we say it distorts the cavity. So imagine you have a nice smooth circular area within the womb, and then imagine you start having bumpy lumps or bumpy structures that affects the space. Okay, so let's assume that there was no fibroid here. The egg is able to nicely come down, meet with sperm, and actually fertilize. So you've got a fertilized egg a fetus has been conceived, what's the next step? It has to implant within the womb. Okay, but if you have a fibroid that has rendered this womb, changed the structure of this womb and made it difficult for the fetus or the baby, sorry, to plant, again, that can affect, that can also affect fertility. So those are two examples. So it could possibly affect fertilization just because of the sheer bulk of the fibroid pressing against the tube, or if that wasn't happening, if it's the fibroid within the cavity that's made the shape or the inside of the cavity irregular, makes it irregular. The fertilized egg just can't find a smooth space where it can nicely root in and bed down and then start growing. That could cause fertility. That's number one. We're talking about the 10 ways that fibroids can stress a woman in pregnancy. So we're talking about different conditions linked between fibroids and pregnancy. So that's one thing that fibroids can do. That's a stress that it could cause. And again, the next thing will be loss of the pregnancy. Okay, so the first one I've just mentioned is even preventing a pregnancy to actually develop. So whether you believe that pregnancy has happened at the time of fertilization or implantation, if the pregnancy has managed to implant, if it's actually managed to get in place, but the fibroids by their very nature can grow. Okay, so even if it managed to get past fertilization, it managed to get into implantation and the baby is trying to grow, as the fibroid is also growing there, it creates a competition and that can lead to pregnancy loss. So the first one we just looked at was prevention, and the second one we just talked about is actually losing the pregnancy. So that's, we're referring to a miscarriage, for example, because we're talking about something happening in the early pregnancy. So that's a second stress event that can happen as a result of the fibroid. Another issue, number 3 now, that could happen is going into labor before time. Usually we say that is 37 completed weeks. So going into labor before term. Now, the fibroid simply being in the cavity. Let's go back to that picture, which I think this picture is still up actually. Yeah. So if we go back to this picture and let's use this particular one as an example because it's the one sitting inside the womb cavity. As it's growing bigger, assuming the pregnancy has continued, it's gone past the first trimester and it's gone into the second trimester, and the baby is growing bigger, and the fibroid may be growing bigger as well, or it might actually stay the same size. But the baby needs all the space within the womb to grow. Okay, so that it just needs that to happen. But the extra size of the fibroid gives the womb gives the sense that the womb is at a particular number of weeks. So what I'm trying to say is that you may have a pregnancy that is 28 or 30 weeks, but because of the extra size of the fibroid, this pregnancy, this womb looks like a 32, 34, 37-week pregnancy and gives the brain the impression that, oh, we're at term. And so it's now time to go into labor. So this is what happens. The fibroid can stretch the womb, make it bigger than it actually is. The womb is only carrying a 32-week baby, but the fibroid in there stretches the womb, making it look like it's 37 weeks and time for labor. So the protective plug in the cervix that normally stays until it's time for labor is lost. And that's how a woman could potentially go into labor. Even though she's not reached 37 weeks, baby is still 31 weeks. It's simply because the fibroid is artificially or tricking the body into thinking, oh, that we're at 37 weeks. And that's related to premature rupture of the membranes. Of course, we know that the baby lives inside a amniotic sac and membranes that contain fluid. That's where the baby lives while it's developing inside mom. And that sac or those membranes only burst when labor, at the time when it's time for labor to begin. That is sure. That watery discharge a woman loses when she's about, or when she goes into labor. Now, if that breaks early, before the baby's ready, that can have a lot of serious problems. It can lead to infection and other issues that can arise, because that's supposed to be, those membranes are supposed to protect the baby until it's time for it to, so until it's mature enough for birth and for labor. And if that happens early, again, because the fibroid is stretching the womb unnaturally, because it's distorting the womb cavity, it can make those waters to break early And that's another stress that can happen because in pregnancy, because of the presence of the fibroids. Okay. Number 5, bleeding before baby is delivered. Fibroids can contribute to blood loss. I said at the beginning, fibroids can cause irregular vaginal bleeding. They can cause heavy periods. That's what they do. That's the nature of these tumors. Okay. First of all, a pregnant womb already carries a lot more blood vessels, as you would expect, because it's not just looking after itself and the mom, it's also looking after the baby. So a lot more blood supply is going to the womb when a woman is pregnant. Having a fibroid, in addition, increases the chance of even more bleeding. Okay, so that means a woman can bleed. A pregnant woman can simply have more bleeding simply because she's pregnant. The other thing as well is a condition known as placental abruption. So this is something where suddenly, when a woman is pregnant, the placenta, that tissue, comes away from the lining of the womb. Now, we know how important the placenta is. It's that rich network of blood vessels that allows transfer of nutrients from the mother to the baby. So that's how baby gets nourishment, gets everything from the mom, and also things come away from the baby to the mom to help get rid of any waste and stuff. Placenta is crucial for survival. Imagine if for some reason it suddenly detaches. That can happen. It's called placental abruption. There are other reasons why it could happen, but having fibroids can make it more likely to happen. So a lot of bleeding can happen that puts mom's life at risk. Because the placenta is injured or damaged, it means that the baby too will also not get blood supply. That's a medical emergency. That's a serious, serious complication. And I've said it can have other reasons, but fibroid is one of them. That irregular architecture of the womb, that I don't know how to say it. The womb that's smooth, it's not irregular, that's caused by the fibroid can contribute to this happening. Okay. We're on to number 6. Okay, please stay with me. If you've got any questions, please let me know. Let me just quickly pop into the chat. There are a couple of people here. Thank you so much for joining. It'd be lovely if you said hi, if you said where you're watching from. That would be great. But as you know, we're talking about fibroids in pregnancy. I think we've just dealt with number 5. So we're looking at the 6th condition, I think, creates stress for women when they are pregnant. And this is about the position, the way the baby lies. Okay. Now I've got a nice picture to share with you. Let me just bring it up, and it's not that one, not that one, not that one. This one. Okay. So this is normal. Okay, this is normal. There are no fibroids here. This is just what you normally, a woman who is very close to term, this is how the baby would usually be lying. Now, the opposite to this is a breech presentation. So in this case, what you're looking at is a normal, we call it cephalic. Cephalic means head, but this is a normal presentation where the baby's head is pointing down, okay, and at the beginning of the birth canal. So this is the womb, and that's the cervix. So here will be the vaginal canal, okay. So this is the common, if you like, quote unquote, normal way. Opposite would be the breech, where the baby's bottom is facing downwards, okay, and that can cause complications. What we usually want is for a vaginal delivery would be the head facing downwards. Of course, there are different things apart from a C-section. Of course, there are different things that you could use if the baby's head is not facing downwards. Yes, you could use forceps and you could use or different assisted methods, but what you generally want is the baby's head in this position. If something else is presenting, so we say here, this is the normal, we say here, baby's head is presenting. If something else is presenting, perhaps the bottom or perhaps the shoulder, that is not normal, or that can create complications in terms of delivery. And delivery it may not be possible to deliver vaginally, and you might need assisted, you might need to have a C-section, to deliver the baby. Why have I brought this up? Imagine if you had the fibroid, let's go back to our picture. So imagine if you had the fibroid like this one here, growing within the cavity and sort of pushing the baby out, because that's what the fibroid does. It sort of pushes things out of the normal way. When the baby is within the when the baby is within its amniotic sac, within its membranes, it's swimming around, it can move around, and as it grows, nature directs it to come in the head presenting position. That's what should happen. And in some cases it doesn't. But having fibroids makes it more likely for another part to present. Okay, so if that is the situation that develops, if that is the situation that happens, you could find that the baby will lie in a way that is not easy for delivery. Okay, and that means that delivery might have to happen through C-section. So that's the sixth of stress issue that could happen with fibroid, a fibroid present within the womb. Now, the other thing, and the seventh issue, is when labor becomes obstructed. So then labor cannot progress. Okay, we're on number 7 now. This can be related to the one I've just talked about, when the presentation is not correct, particularly if, which is probably unlikely because you have scans during pregnancy. But in a scenario where a fibroid is in a way that prevents the baby from moving properly as it should during labor, because what you tend to happen, let's go back to that shot. What tends to happen is, as we get to term, then baby comes lower down. As it comes to the time for labor to start, its head should come in and sit within the pelvis here. Okay, that's what should happen. What if I had one image where, oh yes. So what if you had this type of fibroid? What if there was this type of fibroid going on, the one here? Can you see this fibroid within the canal? So that fibroid is technically obstructing. This is just a very good example. I mean, you could even have one somewhere here or even here that could prevent the baby's natural journey into the canal. That's what this particular fibroid here, that's what it's doing. It can cause obstructed labor. And that means that, of course, it's not possible to deliver vaginally. So that can affect the type of delivery. Birth will have to be by C-section. And did you know, according to some research, women with fibroids are six times more likely to have to deliver via a C-section. Get my words out. 6 times more likely to deliver or to need a cesarean section because of just some of these issues I've demonstrated, because of the position, how the fibroid grows, and so on. So that's number 7. Number 8, we've talked about losing blood during the pregnancy, and we mentioned, just the mere fact that the fibroid is there. We talked about placental abruption, but now blood loss after delivery. Okay, for some women, they can deliver vaginally with a fibroid. Remember, it depends on where the fibroid is located. I've shown you so many images. That's why I shared my screen, so it's not abstract. You can see what I'm trying to explain. So for some women, even those who have fibroids that are outside, they're not within the womb, but just having the fibroid there, the risk of bleeding increases. The first thing that could happen, even if a woman has delivered vaginally, baby is okay, the fibroid hasn't caused any blockage or obstruction, and placenta has been delivered, what should happen next is that the womb starts to contract. That should happen as soon as the placenta is delivered, and that's why we give women an injection after the placenta, after delivering the placenta, towards the end of that stage, so that the womb starts to contract. It's so important for that to happen, because when the womb was large, while the baby was in there, you had so many blood vessels, all the pumping, all the blood going through to facilitate. Baby's heart rate has gone up. Why is it going up? Where is all the blood coming from? It's all this movement between the womb and the baby. Now baby is out. Now you want all this bleeding to start settling down, because if you don't, mom, you might start having blood loss from mom. That's why you want the womb to start moving down, quickly coming down, shrinking down. If a fibroid is there, it makes it difficult for that shrinking to happen, that coming down of the womb to happen. If the womb cannot contract, it is more likely to bleed. So that's another stress that could happen, because the fibroid just being there, remember I said how it distorts things, could prevent the womb from contracting and the bleeding. Because when the womb starts contracting, that means the muscles of the womb starts contracting, squeezing. They'll squeeze shut the blood vessels. So if the womb is just left and the muscles are just sort of relaxed, they're not squeezing, the blood vessels remain open and blood is flowing through. And the reason that could happen is the muscles are trying to contract, but there's something preventing them. The fibroid is just not letting the muscles to act the way they should. So that could happen. Blood, that's how you could have bleeding. And the other thing as well, I almost forgot that, if somebody had a C-section, okay, and they had fibroids and they had a C-section, and the C-section was to remove the baby, okay, don't forget that C-section itself as an operation, a major operation, if you like, is in itself alone associated with blood loss. Having a fibroid present increases the risk of blood loss. So that as a side effect of the surgery, because the fibroid is present, that's another reason you could have bleeding after delivery. So it further complicates the issues that can happen after a C-section. Okay, we're nearly there. The next one, number 9, is pain. Pain. I mean, I really don't need to talk about this one because I'm sure you can imagine how stressful. But even fibroids, let's go back to our image. Let me see if I can find one that demonstrates this. This is just size of fibroid. It's an example of a fibroid. This is, the size of a fibroid as large as a man's hand. So probably, what are we saying, 8-10 centimeters or more. Of course, fibroids can even grow larger than this. So I'm trying to find, let's see. I think this one does it best, actually. Okay, so even if a woman had a fibroid, let's assume there's a fibroid that is not even inside the womb cavity. It's not even inside the cervical canal or edging towards it's not even doing all that. It's sort of sitting out there. Can you see some fibroids can have a stalk? Can you see this little pink bit here? Here's the fibroid, but here is the stalk, like a leaf with a stalk on the tree. So the reason that this is important is because this fibroid, okay, if it goes bigger and bigger and bigger, can start twisting around the stalk, okay, and that can cause pain. A lot of the problems that women can have when they are pregnant with fibroids is pain, because the fibroid twists, it starts causing cramps, causes pain. And the other thing as well, again, back to this picture of ours, is that fibroid can degenerate just like that. Sometimes the fibroid goes so big, okay, the blood supply to the fibroid is not even enough to nourish the fibroid mass itself. And so parts of the fibroid start to die. We call it red degeneration. It can happen in pregnancy. It can also happen if one is not pregnant, but that it causes severe pain. One of the common causes of a woman who is pregnant suddenly gets severe pain in the abdomen or in the tummy. If she's known to have fibroids, that may be the reason, because of that change in the fibroid. Or if she's not known to have fibroids, that's one of the things that we should think about. Is this what's going on that's causing the problem for her? Right, so so far we've looked at 9 different ways fibroids can stress us out in pregnancy. The last one, but not the least important, is mental health. I can go to town talking about how all this can affect. I mean, a woman just needs to have one of these issues I've already mentioned, and you can imagine the stress. Already, pregnancy is a situation or a time of life where a lot of emotion is being expressed, or a lot of, what's the best way to say it? A woman's emotion might be a bit volatile. Is that a good word to use? I'm just trying to think of it. Labile moods are up and down. There might be mood swings simply because of hormone levels, really. Okay, so one day things are okay, one day a bit tearful, one day irritable, one day simply because of hormones. Not every woman, of course. I'm just explaining what could happen. So add into the mix the presence of a fibroid with symptoms causing these problems, whether it's pain, whether it's the worry over what's going to happen when it's time for labor, and so on. So fibroids can affect a woman's mental health, can cause increased anxiety during pregnancy or labor, can affect mood, make a woman's mood low. So I thought it was really important to look at these 10 aspects of 10 ways that fibroids could potentially affect a woman. And I know there are probably a lot more. And if you've got any that you can think of, please let me know. It would be great to hear from you. But I just wanted, before I close, I wanted to share a couple more points related to fibroids and pregnancy. Okay, so having seen all these things, what do we do as doctors? How do we deal with our patients who are pregnant and have fibroids? Well, we usually just monitor and observe, just very simply. Okay, monitor and observe. I know somebody might say, well, if they could cause all these problems, why not just take it out? Because there could be risks if you're trying to remove a fibroid while mom is pregnant. And I'm not saying it's impossible, but there could be risks to both mom and baby. Lots of bleeding, lots of issues around blood, possible complications when you're trying to remove the fibroid with a growing a child in place. So generally, it's not done. And so what we're doing is we're monitoring a woman's pregnancy. If she needs pain relief, we're managing that and treating any complications that might arise. So very rarely, if the fibroid is so big that it might have implications for the pregnancy itself going forward, then a surgeon might need to do what's called a myomectomy, which is a removal of the fibroid during the pregnancy. Very rarely. It's not something that you would want to go into routinely. And there has been some success in some cases. I know I've gone through a report where surgeons did remove a fibroid successfully with an existing pregnancy, and the pregnancy went on. But you want to consider that very carefully, because the risks of bleeding and the risks of harm to the baby, harm to the mother, all those risks are present. What else could we do to treat? What about removing the fibroid? If a woman is having a C-section, can't you just take the fibroid out at the same time? Why not? It is getting more common. It's an idea that it's out there, but it also has risks. Remember, we talked about, we've already said that C-section, major surgery, removing, trying to manage bleeding, the risk of bleeding. You want to be very careful. Risk to other organs. A pregnant womb is one that is already, there's a lot of blood vessels going on there. You want to be very careful how you handle that. And you add into the mix of that, trying to deal with the blood vessels after you've taken out a fibroid. If any blood vessels are not properly closed or sealed off, bleeding can be a very big risk after that kind of surgery. So the general thinking is that the safest option is to wait until after delivery. If this fibroid wasn't addressed before, probably it could have been addressed before. If a woman was aware of her fibroids and how their position, their location, how big they were, she and her gynecologist might decide, okay, before you think of getting pregnant, for the next few months, let's address the fibroids and sort of get things. That's one way. Hormone therapy could be an option. Hormone therapy, for example, to shrink the fibroid could be an option, and then followed with surgery subsequently. So that's before falling pregnant. But if we're at the point where pregnancy has happened and there's a fibroid, the safest would be to wait. Unless there's any particular risk to the baby, the safest thing might be to wait until after delivery to remove the fibroid, okay? What medical treatments are available during pregnancy? So limited, you can't give hormones. So what we're doing is we're giving painkillers if needed, if required. That's what we would work towards. Please excuse any noise. I've got doors and windows open around me because it is so hot. So you might hear doors slamming because we've got people walking around here and doing all sorts of things at home. So anyway, so I think we've covered. I'm just checking to see if I've got any more points. And usually treatment is better before or after pregnancy. And it depends. It depends on the symptoms that you have. It depends on the size, the type of fibroids. So there you go. Don't forget, of course, surgery is not the only thing. I know I've mentioned myomectomy, but there is ablation of the womb, where because you're trying to remove all the effects of the fibroids, you're removing the inner lining of the womb. Now, this is after a woman has had her baby, and particularly if she doesn't intend to have any more children, you could treat the fibroid by ablation, so removing the inner lining of the womb. There's also uterine fibroid embolization as a treatment method, is an alternative to surgery. So it's important that that's discussed, but it depends on the individual stage. I wouldn't recommend those options for a woman who is pregnant because there may be an effect on her fertility. So I think I've covered everything I wanted to look at in this topic. Thank you very much to Philomena Ohave, who gave us this topic idea. I think it's really important to have a look. So we have some of it to have at the back of our minds, but just having a talk through about it. And I'd really love to hear back from you if you've got any questions or any thoughts. Any specific areas or questions you want covering, don't forget you can use our not playlist. You can use our health information service to ask a question if you want specific to your own situation, because remember, it's not possible to give specialized advice on YouTube. We need to be discreet. We need to make sure that we're getting as much information as possible, which is not possible in YouTube comments section. But if it's general inquiries or suggestions for videos that you'd love to hear about, please send it through to me. So especially if you're watching on the replay, thank you so much for watching. And don't forget to give this video a like and a subscribe. I'm going to continue doing our live classes for the next few months, I think until the autumn. So please let me know. There's lots of room for different ideas that we could explore together. Thank you so much for joining me. I really appreciate it. I'm going to sign off now. And I hope that you have a lovely weekend. I hope that it's not too hot where you are. But even if it is, make sure you do things like taking plenty of fluids, dress coolly, linen-based clothing if possible, and just keep yourself well hydrated, because this weather is something else at the moment. Anyway, guys, thank you so much for joining me. Have a blessed week and a blessed weekend, and I will see you again soon. Bye-bye.